The Embracing Anti-Discrimination, Unbiased Curricula, and Advancing Truth in Education, or the EDUCATE Act, is a congressional bill banning race-based mandates at medical schools and accrediting institutions. North Carolina Congressman Greg Murphy helped introduce the bill. He's a doctor himself, so he's here now to share more information about that legislation. Congressman, good to see you. Before we do get to that, how are you taking in the Elon Musk-Trump fight? Is it the talk of the town?
Oh, absolutely. And Tim, it's kind of funny because we joke about when this breakup was going to occur, not if, but when it was going to occur. When you have two people with such, strong egos, with such strong personas, the bromance had to break at some point. Hopefully there'll be a reunion and hopefully all things will be settled down. But it was honestly, it was childish in some of the things that were done. And so, the nation doesn't need it. It's a blemish on some of the great work that has been done so far.
Well, do you worry it's a distraction to get things done like the bill passed?
No, I don't. I think this will be a blip. I hope it's just a blip. The word is that Musk wants to bury the hatchet and everything, and he needs to apologize for some of the things that he has said. But we know, look, the bill needs to be strengthened. I absolutely believe it does from the House version. I think there's several things that, I was about 80% yes, about 10% and 10% I didn't like. Made that known with also having in conversations with our senators to try to get things out of it, to strengthen it, to make it a better bill for the American people.
All right, so let's talk about this bill regarding the medical community. And you've been pushing this on social media and whatnot for some time. So tell us why this is so important to you.
Tim, when a patient goes in to see a physician, they are expecting excellence. They are expecting professionalism. They put their trust. I think it's really, other than maybe the nurse, people think the most trustworthy profession is being a physician. And we have historically always taken the smartest, the most hard-driving, the most hard-working individuals as our physicians. And now all of a sudden with the DEI movement that polluted the country several years ago, unfortunately is going away. This came into the admissions process. It even got into the testing for medical schools, into the curriculum. And it just has thrown an agenda into medical schools that was never there, never needed to be there, and it does nothing to help with patient care. I've worked in Eastern North Carolina for over 30 years, and we have a large, minority, more Hispanic migrant population, and it is an affront to me to think that someone thinks that I would take any less care of anybody because they don't look like I do. In fact, most of the patients I take care of now don't. And so this was pushed by some folks in healthcare leadership and healthcare education, by the AAMC. I'm not afraid to call them out right now. And it's wrong. It's wrong. We want the best, the smartest, and we want to elevate everybody. But doing things according to race is just as bad as if it was done 50 years ago or whatever with race when it was the other way around. So it's wrong. We want the best and the brightest. We want to elevate everybody to be the best doctor possible.
On the other side of that, to some extent, there are people out there that feel more comfortable, whether it's gender, someone going to a doctor that's a woman like them, or someone that is black, sure, that feels more comfortable with a doctor that looks like them. Can that happen without these programs?
Yes, it absolutely can happen, and it has been happening. Look at Ben Carson. I mean, he's the perfect example of someone that came out of very difficult circumstances, and a brilliant neurosurgeon. We have hordes of doctors in Eastern North Carolina that don't look like I do, that do excellent jobs. But there's no reason that we should ask that patient to accept somebody as a physician who does not meet the qualifications. And the only qualification was maybe what they believe or what they look like. That's not something that you want out of a physician. Look, I had a tumor surgery in my brain a year ago. You and I talked about this. I did not care what that person looked like. I cared about them doing the best job possible on the surgery. And that's all that we should be caring about with our physicians.
One last question. What is the path of this bill in terms of getting through, do you think? Does this happen?
Well, I think it does, because, the president has made it very clear that the division, the discrimination, the degradation really that has occurred with DEI is not to be tolerated. And so we don't need that in medical schools. You look at UCLA. UCLA is the perfect example that they opened this up to this type of admissions process. And last year, half of their class could not pass the first step examination. So they were letting people in who were not qualified to be doctors and based it upon other factors other than intelligence, hard work, all these things that we have historically wanted to be as physicians. I think it's, I honestly, it's a bipartisan issue. I've been told by several Democrats who, maybe don't want to speak it publicly, but thank me for doing this.
Okay, we'll continue to follow it. Congressman, it's always a pleasure to see you. Thank you for your time tonight, sir.
All right. Have a great day.
All right.